past 10 months of this pandemic has been so devastating and unlike any other point in my career.
Just seeing what this pandemic, what this virus has done to the community that Dimick serves has been heartbreaking.
One of our individual almost died from COVID, and the people that we work with were like family members. I never knew I can pray and cry that hard to God for him, for his recovery,
The amount of infection, the amount of disease, the amount of, terrible health impacts and even death, unfortunately, has been so significant. But I think even beyond that, and I'm also saying this as a doctor in a community health center, right? We see our families and their lives, not just their health, but how their lives are impacted. And so when we see, kids whose education has been interrupted, parents who have lost their livelihood, our clients who live in our long-term care settings, they can't see their family members because everybody's on restriction, lost jobs, closed businesses. It really, truly has been devastating. I think that having this COVID-19 vaccine, I cannot wait to be able to offer this to my patients and to my community here at Dimick.
If we want kind of life to be as what we knew, it's going to take a lot of people to get involved and be vaccinated.
I think that it's always easier if you know somebody who's gone through something, who's gone through this. And so hopefully being able to be that inspiration for people who are either on the fence or concerned about the vaccine, to see that I've done it and I'm fine, and and hopefully that will inspire them to want to get the vaccine as well.
We all need to do our part, I'm trying to end this pandemic. I want to go on vacation.
I think this is just an exciting time, and I think we've waited a really long time for this.
I was just on the phone with my mother before I came. I was like, I'm about to go take the vaccine. She said, I can't wait to take mine too.
I can't wait for my family to be able to have the opportunity to get access to this vaccine as well.
What I've learned through this experience, I hope to be able to share with people, especially those who may have some reservation on taking the vaccination.
I'm really, really glad that I had the opportunity to get this vaccine. I feel really comfortable with the science. I feel like the science has actually been looked at very, very closely. So I feel quite safe in getting this vaccine, and I think it's going to be a terrific tool to fight this pandemic.
I think it's natural to be a little anxious, a little nervous, so I was a little anxious, but I also felt a little bit of a sense of pride.
A big part of my year was unfortunately accented by the fact that I lost a really close friend. A friend that I knew since I was 15 when I landed at college, and he was one of the first 1,000 people to pass away in this pandemic. So it was kind of a rude awakening to just the severity of what this was. As a black male, I am 1.5 times more likely to get infected. I am 4 times more likely to be hospitalized if I'm infected. I'm 3 times more likely to die. So I put those pieces together, also in the context of already having lost a friend to this and hearing of other people, family members getting sick. It became, for me, that was the equation, that was the math, that was the calculus that I used to say, I need to get this vaccine as soon as I can. This is an opportunity for me to take some power. I can decide about this vaccine, it's not mandated. And I can take the power now understanding how this can impact my family and my community. I can control that. So I can step up and say, yes, I'm going to do this, and I'm doing it from a place of power. I trust the science, I trust the data, I've wrestled with the science and wrestled with the data. So this is not just simply me saying, oh, because I'm a doctor, I trust it. I got deep, I wrestled with it, I talked to other people, I engaged in real conversation, and it's through that process, through that analytical process, that I got comfortable saying, this is important for me, it's important for my family, and it's important for my community. And I don't want us to be left behind.
last 10 months of this pandemic has been so devastating and unlike any other point in my career.
Just seeing what this pandemic, what this virus has done to the community that Dimick serves has been heartbreaking.
One of our individual almost died from COVID, and the people that we work with were like family members. I never knew I can pray and cry that hard to God for him, for his recovery,
The amount of infection, the amount of disease, the amount of, terrible health impacts and even death, unfortunately, has been so significant. But I think even beyond that, and I'm also saying this as a doctor in a community health center, right? We see our families and their lives, not just their health, but how their lives are impacted. And so when we see, kids whose education has been interrupted, parents who have lost their livelihood, our clients who live in our long-term care settings that can't see their family members because everybody's on restriction, lost jobs, closed businesses, it really truly has been devastating. I think that having this COVID-19 vaccine, I cannot wait to be able to offer this to my patients and to my community here at Dimick.
If we want kind of life to be as what we knew, it's going to take a lot of people to get involved and be vaccinated.
I think that it's always easier if you know somebody who's gone through something, who's gone through this, and so hopefully being able to be that inspiration for people who are either on the fence or concerned about the vaccine, to see that I've done it and I'm fine, and and hopefully that will inspire them to want to get the vaccine as well.
We all need to do our part, I'm trying to end this pandemic. I want to go on vacation.
I think this is just an exciting time, and I think we've waited a really long time for this.
I was just on the phone with my mother before I came. I was like, I'm about to go take the vaccine. She said, I can't wait to take mine too.
I can't wait for my family to be able to have the opportunity to get access to this vaccine as well.
What I've learned through this experience, I hope to be able to share with people, especially those who may have some reservation on taking the vaccination.
I'm really, really glad that I had the opportunity to get this vaccine. I feel really comfortable with the science. I feel like the science has actually been looked at very, very closely. So I feel quite safe in getting this vaccine, and I think it's going to be a terrific tool to fight this pandemic.
I think it's natural to be a little anxious, a little nervous, so I was a little anxious, but I also felt a little bit of a sense of pride.
A big part of my year was unfortunately accented by the fact that I lost a really close friend. A friend that I knew since I was 15 when I landed at college, and he was one of the first 1,000 people to pass away in this pandemic. So it was kind of a rude awakening to just the severity of what this was. As a black male, I am 1.5 times more likely to get infected. I am 4 times more likely to be hospitalized if I'm infected. I'm 3 times more likely to die. So I put those pieces together, also in the context of already having lost a friend to this and hearing of other people, family members getting sick. It became, for me, that was the equation, that was the math, that was the calculus that I used to say, I need to get this vaccine as soon as I can. This is an opportunity for me to take some power. I can decide about this vaccine, it's not mandated. And I can take the power now, understanding how this can impact my family and my community. I can control that. So I can step up and say, yes, I'm going to do this, and I'm doing it from a place of power. I trust the science, I trust the data, I've wrestled with the science and wrestled with the data. So this is not just simply me saying, oh, because I'm a doctor, I trust it. I got deep, I wrestled with it, I talked to other people, I engaged in real conversation, and it's through that process, through that analytical process, that I got comfortable saying, this is important for me, it's important for my family, and it's important for my community. And I don't want us to be left behind.
Good afternoon. Welcome, DIMIC family, to DIMIC's annual meeting. My name is Raquel Rosenblatt, and I'm the Chief Development Officer here at the DIMIC Center. If you tuned in a few minutes ago, you saw some terrific videos of DIMIC staff, the first 4 who got vaccinated here at DIMIC, and our new CEO, Dr. Anderson, speaking about the importance of the COVID vaccine in our community. These videos were created by our special DIMIC partner, Blue Cross and Blue Shield of Massachusetts, as a way to help build confidence in the vaccine in communities of color. The videos are being shown broadly through Blue Cross and DIMIC channels. And these videos were the impetus and inspiration for us to create our DIMIC Vaccine Street Team, which you'll see and hear more about soon. This past year has been incredibly challenging for all of us, especially DIMIC's patients and families. We are so grateful to all of you for your support in ensuring the care of our community over this past year. Thank you. Last April, I wrote a poem about what we can gain from the pandemic in the face of such tremendous loss. This was a way to be grateful and positive even when such awful things were happening. When I now look back on the past 12 months of the pandemic and the increased racism in our country, it is crystal clear to me that what has been the most significant thing that we have gained is a greater sense of community. Be it via squares on a Zoom call, standing 6 feet apart and talking with our neighbors outdoors, or wearing masks while we talk with colleagues in our offices, we savor the connections with others and realize that these are vital to heal from the pandemic and from racial and ethnic hatred and violence. This sense of community could not be more apparent here at the DIMIC Center. Through today's annual meeting, I hope you feel that power of community. And before we hear from our board chair, Bob Rivers, I'd like to show you a video from the past summer that exemplifies this. It's our 6th annual Road to Wellness video. Let's take a look.
7 years ago, when I started to look at the health disparities in Roxbury compared to Back Bay, being that those in Roxbury only live to the age of 58, and Back Bay, which is less than a mile away, the life expectancy being the age of 91, I felt like there was something that we needed to do about it. And we all came to the conclusion that a 5K run, 3K walk would be something that would be amazing.
The Road to Wellness is an incredibly meaningful event, not only for the DIMIC Center and for our other partners, HoodFit and the Boston Athletic Association, but also for all members of our Roxbury neighborhood and other parts of the city of Boston. This year especially, the Road to Wellness is so important. It's a way for us to come together after a challenging time and begin to heal. We are so thrilled to celebrate the 6th annual Road to Wellness and so grateful for our community for participating.
Takes health and fitness, which is the mission of the BAA, to promote health and fitness, and brings it to life for a community in Boston, in Roxbury, where it can only benefit everybody. We know that we don't have the answer to everybody's health and wellness issues, but when those answers come from the community itself, come from the DIMIC, come from HoodFit, come from the people who live here, they must be the right answers. We are very, very pleased to be a small part of that.
It means a lot to Tufts Healthline. We have been presenting sponsors now for 5 years. It means a lot to the community. Wellness is so critical in our community, and we're proud to be part of this Road to Wellness, to continue to promote health, exercise, and wellness in the community.
So Road to Wellness is about really getting our community active and involved. Active out from being sitting on the couch, active from being sedentary, active from just accepting bad health. We're getting people not only active and moving, we're teaching them about fitness, teaching them about running, teaching them about self-worth, about what fitness means to life.
As coaches, and for the mission for this race, today exemplified what we wanted all along for the Road to Wellness 5K, for it to be a community event, for everybody to feel wholly involved and to see measurable improvement and the joy on everyone's faces as they crossed our invisible finish line.
So the trainings are awesome. Everybody's awesome. They're very encouraging, motivating, to inspire you to reach a goal. This is the perfect opportunity, the perfect time for you to engage, meet people, and reach any type of goal when it comes to fitness, or even if it's just running, if you have a running goal.
The Road to Wellness means to me to push myself and to be better and to stay in shape and to show up every week and hold myself accountable. And every week that I show up, to just do better and be a better version of myself the week prior.
To me, the Road to Wellness means literally what it says, like a road to getting well, a road to getting healthier, to adding more benefits to you, living longer, to getting yourself well.
The Road to Wellness this year of all times, to me, is very important because of the fact that we've been quarantined so long that many of us, whatever routines we had about staying healthy, we've let go by. So this is an opportunity to reboot, start up again, and live a healthier and longer life.
Well, I hope you feel incredibly energized. And you can look forward to joining us this year for another amazing Road to Wellness in September, with summer training kicking off on Saturday, June 5th. We have a dynamic agenda for you all today, including an important conversation about equity, videos of DMIC's vaccine street team members, and special remarks by DMIC board leaders and legislative leaders. It's now my pleasure to introduce someone who is an esteemed leader, a role model, and a dedicated friend, Bob Rivers, Chairman and CEO of Eastern Bank and the Chair of DMIC's Community Foundation Board. In this past year, Bob has exemplified leadership. He's taken proactive stands against racism and hatred. He's generously supported DMIC and our community, and he has been a visionary, moving DMIC forward at this critical time. Thank you so much, Bob, and we're thrilled to hear from you now.
Oh, there we go. All right, folks. Well, Raquel, thank you. Thank you for all of your great work this past year. And thanks for the kind introduction. And I want to wish all of you a good afternoon and welcome to DMIC's annual meeting. It's a pleasure to have so many of our DMIC family members here today: staff, patients, families, board members, legislative leaders, generous supporters, and community members. Thank you all for supporting DMIC during the past very challenging year. 1 year ago at this time, we had to cancel our annual meeting, scheduled from the start at the start of the pandemic. At the time, the concept of pivoting to a virtual event was daunting. Now, 1 year and many Zoom and team gatherings later, I'm so glad that we can be together here today, at least virtually. And I have a feeling, really a sense of optimism, as I hope you are too, that we'll be back together again soon in person. I'm also feeling grateful that we can share some time together this afternoon to focus on a truly vital topic: racial and health equity. I'd like to extend a special welcome to the legislative leaders who are joining us today: Attorney General Maura Healey, City of Boston Chief of Health and Human Services, Marty Martinez, and Representative John Santiago. We truly appreciate your continued advocacy and your support of DMIC. And welcome also to Greg Schell, the Managing Director of Bain Capital Double Impact and a founding leader of the new Commonwealth Racial Equity and Social Justice Fund. Today's keynote will be a conversation between Greg and DMIC's President and CEO, Dr. Charles Anderson. Among our generous supporters, I'd like to recognize the members of our Community Foundation Board, the Health Services and Community Service Boards, and the President's Council. Your dedication and generosity impact DMIC patients and families all year long, breaking down barriers to care and helping to create a healthier and more equitable Boston. Let me also recognize DMIC's senior leadership team, led by Dr. Charles Anderson. Many thanks to Peter Girondo, who served as interim president and CEO for much of the past year and before, as well as the entire staff for your incredible dedication and leadership in moving DMIC forward over these past 12 months. So much has happened since our last annual meeting, including welcoming the following new leaders to our boards. Melissa McDonald, President of the Liberty Mutual Foundation and Vice President of Liberty Mutual Insurance. Tara Capilla, Vice President of Growth at National Grid, who both have joined our Community Foundation Board. Diane McCarthy, General Counsel for the Center of Health Information and Analysis, became Chair of our Community Services Board. And Dr. Ryan Boxill, Chief Behavioral Health Officer at Boston Medical Center, is now Vice Chair of that board. And Mike Kincaid, Communications and Outreach Coordinator at Mass General Hospital, became Chair of the Health Services Board. Each of these talented leaders bring tremendous skill, passion, and a deep commitment to DMIC's mission. Our theme for today's annual meeting is racial and health equity through the lens of COVID-19. From our founding in 1862, as the New England Hospital for Women and Children, DMIC has had the goal of breaking down barriers to care and correcting long-standing racial and gender health equities. During the past year, this commitment to health equity has never been more important. In a year of tremendous hardship, together, we have remained true to our mission to serve Boston's most vulnerable. When I think about the past year, I am incredibly proud of the response to the urgent needs of our community that we have achieved together. You helped us provide our patients, families, and community with COVID testing and contact tracing, 2 COVID treatment units for people in recovery from addiction, and healthy meals. And you made sure that all of our critical services continued without pause via telehealth or in person, including comprehensive health care, mental health support, substance use disorder treatment, family shelter, and early education. Many of you gave generously to our emergency fund to ensure our continued care for all in our community. Others promoted DMIC's work and encouraged people to come here for help. And most importantly, if you were on DMIC staff, you cared for people who had COVID, who were battling substance abuse disorder, and who needed mental health support. Early on in the pandemic, we saw a dramatic increase in the need for food assistance in our community. Support from key partners allowed us to rise up to meet this need and begin offering regular meal distributions to our patients and families. I want to give a special thanks to the Harvard Pilgrim Healthcare Foundation, the Stop and Shop companies, Teddy's team, Project Bread, and volunteers from the Red Sox, John Hancock, and the Commonwealth Care Alliance for helping to meet this critical need. Even in the face of the pain and challenge of the past year, we had some wonderful highlights that reminded us of the power of community, both virtually and in person. Last summer, we held weekly free safe outdoor trainings for our 6th annual Road to Wellness 5K. And we had a successful virtual walk run on September 10th in partnership with the Boston Athletic Association and HoodFit, our presenting sponsor, TELF's Health Plan, and many other generous supporters. It was clear that the mission of the Road to Wellness to reduce health disparities was never more essential than in 2020. The Road to Wellness renewed our sense of commitment to combating health inequities in our neighborhoods and reminded us that we are all on a lifelong journey together to good health. We also held our first ever virtual Steppin' Out last October, raising close to $1.2 million. This success affirmed the vital role Steppin' Out plays in bringing together our community and that we can still achieve this virtually. Funds from Stepping Out ensure that DMIC can respond to all the growing needs of our patients and families. The start of 2021 was highlighted by welcoming Dr. Charles Anderson to the DMIC family as our new president and CEO. As many of you know, Charles is an inspiring leader, a caring pediatrician, and a groundbreaking innovator. We are excited to partner with him in all that is ahead for DMIC, and you'll hear more from Dr. Anderson soon during our program. Now, a priority of DMIC's work is twofold: providing the vaccine to our patients, our staff, and members of the community, and helping people gain trust in the vaccine and be ready to take it. With communities of color being hit hardest by the COVID-19 pandemic, yet having the lowest rates of vaccination to date, we see this effort as an essential piece of an equitable vaccine rollout. These successes, along with many others, are examples of the significance of our partnerships and the tremendous support that DMIC receives. Together, we can help heal and transform more lives, provide a place for more adults seeking recovery, and give more children a promising education and future. This is DMIC at its best, and together, we are DMIC. Thank you again for your commitment, and I hope that you'll stay connected with DMIC after today, coming to our other events, engaging with us on social media, and supporting our work. It is now my pleasure to introduce to you DMIC's Vaccine Street Team. This is a group of leaders among DMIC staff and community who are sharing their vaccine stories with others. In doing so, they are helping build trust, confidence, and excitement for the promise of a brighter tomorrow for our community. You'll see a few videos of our street team members today, and I'd like to thank the entire street team for their commitments to promoting this important message. Our street team includes our Foundation Board Chair Emeritus, Flash Wiley, and Benny Wiley, co-creators of the DMIC Street Team, Sheila Brown, Milton Benjamin and Joan Wallace Benjamin, Dorlyn Bibby, Bernie and Carol Fulk, Reverend Ray Hammond and Reverend Dr. Gloria White Hammond, Conan Harris, Deborah and Dwayne Jackson, Thaddeus Miles, DMIC's immediate past CEO, Dr. Maisha Minter Jordan, Dr. Keith Motley and Angela Motley, Annie Russell, Richard and Kathy Taylor, Sandra Waldron, and Reverend Liz Walker. Let's take a look at our first street team video.
Well, just like many of us, I also have a multi-generational household. I have a 93-year-old dad and a daughter who has many different health conditions. So I felt it was very important for me to be vaccinated so I can be safe. So, there's always the fear that you're going to come home and bring something. I am in a healthcare setting after all, and we've been seeing patients. So I felt a great deal of responsibility to look into it, to make sure that I had enough information to make the decision and to really get the vaccination as soon as it became available to me. Aside from feeling normal and being able to go out and do the things we all used to do, I am really looking forward to spending time with my grandkids. And that gets me a little emotional, but being able to hug them and see them as much as I used to is something that I'm truly, truly looking forward to.
Thank you so much, Bob, for those important remarks and recap. And what a terrific video of DMIC's Community Outreach Coordinator, Sandra Waldron, a member of our DMIC Vaccine Street Team. It's a pleasure now to introduce Bruce Figueroa, our board treasurer, to provide a financial report about DMIC's standing.
Thanks, Raquel. Good afternoon and welcome. I'm Bruce Figueroa, and I co-chair DMIC's Finance Committee with Tony Wood. I'm pleased to join you today to report on DMIC's financial performance for its latest fiscal year, which ended on June 30th, 2020. I will be sharing the numbers, but also examples of how our financial success allows DMIC to both continue and expand its critical mission in the community. In fiscal year 2020, DMIC continued its trend of solid financial performance, specifically for the 8th consecutive year. DMIC recorded a surplus from operations, and that surplus was approximately $1.4 million, a threefold increase over fiscal year 2019. DMIC's improved financial performance was driven by broad donor support for our diverse services as the pandemic began, with the realization and achievement of an emergency fund that exceeded $1 million in donations by the end of the fiscal year, less than 4 months into the pandemic. To our individual donors, our foundation, government, and corporate partners, and to our board members, thank you for that tremendous support. It made such a difference. DMIC's financial strength can be summarized by highlighting a few balance sheet measures as of our fiscal year. First, DMIC had approximately $12.1 million in operating cash on hand, an all-time high and critical given the uncertainties we faced last year. Secondly, the organization formed a capital reserve fund valued at $2.1 million to address future capital building needs. And at present, our buildings represent our largest asset with a book value of over $38 million. And finally, DMIC continues to grow our separate endowment fund, now valued at $3.8 million. DMIC's financial position was also enhanced by solid financial operations. For instance, account receivables from our insurers and our contracting agencies were significantly better than industry standards, while payments to vendors were well within expected payment terms, ensuring no overdue liabilities. As a result, all of our financial covenants required by our federal, state, and bank partners were met at the close of the fiscal year. And this is really thanks to the focus and the diligence of our tremendous financial staff. As we all know, COVID has presented significant challenges to all of us, both personally and professionally. And I have to say, from my vantage point as finance co-chair, I saw how our management team met those challenges head on while continuing to serve our patients and community through our in-person and various new electronic communication methods. At the beginning of our pandemic, our financial resources were quickly deployed to initiate COVID testing facilities for the community. DMIC also applied for and received a federal payroll protection program, or PPP grant, and used that grant and other available funding to keep all of our 600 community-based employees employed throughout this crisis. Within our residential programs, DMIC actually was able to reverse local and national employment trends by adding community jobs while developing and converting campus space into inpatient COVID units for substance abuse patients who had acquired the virus. The leadership team was nimble and thoughtful in its approach to the pandemic, always putting staff and community safety first, creating socially distanced opportunities to continue to safely serve our patients and to protect staff. Even today, as we speak, DMIC has developed a robust vaccine site with a vacant campus building with the goal of vaccinating upwards of 1,000 community members each week. It's been truly remarkable how federal, state, and donor gifts have been utilized by the team to battle this pandemic, protect the community, address racial inequities, keep staff employed, and even create additional employment opportunities. You should also know that DMIC continues to achieve its financial targets 7 months into our current fiscal year, despite the ongoing challenges. Our financial performance has allowed us to focus on future growth and success. The leadership team is working with architects and construction personnel to design and develop plans to expand and create more efficient patient services within our current health center buildings. A similar exercise is also being conducted to renovate and convert parts of the Z building into a short-term inpatient unit for men exiting the detox unit, but still needing additional inpatient support and care. Each project looks to take advantage of future federal infrastructure dollars that may be available under Biden administration stimulus packages. So I hope this brief financial summary has given you a sense of our financial strength, as well as our progress in serving the community. As finance chairs, both Tony and I look forward to working with Dr. Anderson and the DMIC team to further enhance its reputation as both a premier provider of health and human services, but also as a leading employer in our neighborhood. So I want to end by saying thank you for your ongoing commitment to our important mission.
Thanks so much, Bruce. We're so grateful to you and the entire Finance Committee and our CFO, Peter Girondo, for all you do to keep DMIC fiscally strong and sound. It's time to meet another DMIC Vaccine Street team member, someone many of you already know, Thaddeus Miles, founder of HoodFit, Road to Wellness 5K partner, and Director of Community Services for Mass Housing.
Don't just look at what the vaccine may do. Look at how do you want to live? How do you really want to move forward? What I'm really looking forward to, again, is for me to be able to take my photography, to be able to create some images, to be able to embrace my family and be able to show love and be loved, and to be able to be with some of my friends and to have a dinner with them where we all feel comfortable, and just to be able to gather and to rejoice and to rebuild my spirit by connectivity. Being human is really about connectivity. It's about social interaction, and I'm really looking forward to that.
Thank you so much, Thaddeus, and the entire street team, led by Flash and Benny Wiley, for your incredible messages to help build confidence and trust in the vaccine. We'll be sharing all of the street team videos in our DMIC communication channels for you to see. The vaccine street team's efforts are a prime example of working for racial and health equity in our community, something we will be hearing more about next. It is now my honor to introduce our keynote speakers. Dr. Charles Anderson joined the DMIC family in January as our president and CEO. He has a wonderfully diverse background and rich experiences as a neonatologist and pediatrician, healthcare leader, business creator, and also as a musician. He's embraced DMIC and is a kind, inspiring, and positive leader and partner. Greg Schell is a wonderful DMIC friend. He's managing director of Bain Capital Double Impact, a founding leader of the New Commonwealth Racial Equity and Social Justice Fund, created last summer, and a member of our President's Council. Dr. Anderson and Greg are good friends, and their conversation will be open, honest, and personal about racial and health equity. They'll use the pandemic to frame their discussion and also speak more broadly about these issues. Dr. Anderson and Greg will speak for about 15 minutes and then take questions. As you're listening, please feel free to put your questions in the Q&A section at the bottom of your screen instead of the chat, so we'll be sure to see them. Dr. Anderson and Mr. Schell will respond to as many questions as time allows today. We're in for a great conversation. Thank you both for kicking it off now.
Thank you. This is a real pleasure. Dr. Anderson, or as I have come to know you, Charles, it's good to be with you and with the entirety of the DMIC community. Charles, you are the right person for this job in the eyes of many. I have gotten to know you as a distinguished physician, as an executive, as an investment professional, but I also know very well the two iconic leaders of DMIC that you will replace. How do you want to get to know the DMIC community writ large, and how do you want them to continue to get to know you?
Thank you, Greg, and really appreciate this. And it's great seeing you. I feel like we haven't seen each other in a while, so this is wonderful. Let me start with this because I think it's a very important question. And when I think about my engagement with this DMIC community, we've had the wonderful opportunity to do a range of meet and greets. And what I really tried to emphasize are three primary points. First and most importantly, it's what I bring is a deep commitment to the population we serve at the DMIC Center and an understanding of the social determinants of health that, quite honestly, I learned from direct early experiences. I think that's really important here. I spent my early years living and caring for patients in a community very much like Roxbury in Buffalo, New York. My father immigrated from Jamaica to fulfill his dream of becoming a doctor and built his practice in the low-income, diverse community where we lived at the time. My mother escaped the atrocities of the Deep South, and she earned a master's in economics and really pulled us along in all of her endeavors to advocate for the most vulnerable members of our community. And what was really most remarkable, and I remember, this was actually before community health centers came to Buffalo. And I remember my father adding a lab, adding imaging, pharmacy, and an addiction program to the practice. And it really was about how to address the gaps that he identified in caring for the community, very similar to what we do here at the Dimick Center. And as a family, we got involved with so many other elements of advocacy, which reminds me constantly of this broad scope of what is healthcare. We advocated for education, housing, and other critical resources. I mean, it's no wonder that when I went to Hopkins for medical school, that was one of the first medical students to find his way across the street to the School of Public Health and to do my master's in public health and maternal and child health, and even teach at a school for pregnant teenagers. But I think, secondly, what I really want to make sure I emphasize that I bring to this community is the real world experiences that both you and Raquel have actually described. As a pediatrician and newborn intensive care physician, I definitely understand the experience of direct patient care and the huge responsibility that comes with that. Combined with that, having been a faculty member at all three of our Boston academic medical centers, it's crazy when I think about it because I'm not that old. But I understand what it takes to conduct clinical research and the important role we play as educators in preparing young, talented people to become doctors. Having been a manager in the healthcare practice at Deloitte, I understand how to think strategically and to work with cross-functional teams to get results. Having been a hospital executive, I understand what it means to have P&L responsibility. And as co-founder and operator at a private equity firm, I know my way around a balance sheet. I'm probably one of the handful of physicians that do, but when you're in that situation, you can appreciate this, Greg, is that you're trying to figure out how to achieve growth without tripping debt covenants. So I really understand the complexity thereby. And lastly, what I'd leave us with in this one in terms of what I bring, it's last but definitely not least, is I bring a set of values and really habits. In our family, we have these 5 habits of positivity that were developed by my lovely wife and surgeon, author, just amazing leader of our family that really shape what I call my positive leadership style. And number 1 is that there's always a solution. We just have to work to find it. Number 2 is that we convert a limit into an opportunity. Number 3 is that we keep the positive and we discard the negative. Number 4 is that we find purpose in caring for others. And number 5 is that we always are thankful and that we always believe.
Charles, there's so much in there. You've given us a lot of material. I'm really intrigued by this statement of there's always a solution. Your tenure as CEO of the Dimick Center will always be inextricably linked to this current, healthcare crisis. On the one hand, you could make the statement that this is unique and requires unique solutions. On the other, Charles, this population that you and the Dimick serves at some level has always, been in crisis when it comes to healthcare. I want you to explore a little bit about that link between health disparity and health outcomes and race and income.
Yeah, it's really important because one of the things that this pandemic has definitely taught us, Greg, is that these underlying disparities, or should we say these underlying inequities, these underlying differences in opportunities really play themselves out when we have a situation like we're dealing with. There's no doubt in any of our minds who've been following this work and been involved in this for the years that we have, that in any situation where everyone else gets the sniffles, their communities like Roxbury, they get double pneumonia. And that's exactly what we're seeing. But where that comes from is these underlying inequities in access to basic things, right? Everything from housing that is safe and has the appropriate spacing so that when you do have an infection like a coronavirus, that it doesn't spread so rapidly from individual to individual. Opportunities to have access to outside space so that you can get out and do those things that actually both strengthen your health, but in a situation like this, the safest place to be was to be outside. We saw this in Newton where people are walking up and down Comm Ave and doing those things and experiencing a very, very different type of pandemic. So, I mean, those are the things that help us to understand the connection here If you don't have access to healthy food, if you don't have the same sort of access to healthy opportunities for exercise, that puts you in a position where you're disadvantaged when a pandemic like this comes through.
You've talked some about social determinants, and obviously DMIC has understood this concept, perhaps long before others. Charles, some of this, there are solutions, as you say in your household. Some seem indetractable, things like housing or sort of educational attainment or income. They're not so easy to change. Talk a little bit about the role of a community health center, and then I want you to talk a little bit more broadly at the population health level. What kind of solutions do we need to see as a broader community, including policy prognoses that you think accelerate all of the ways that we can close these inequities as you describe them?
Sure. Well, I think an important way to think about it is through the lens of what is a federally qualified health center. When you think about this movement in the mid 60s, and yes, 1965, I was all of 3 years old, but my life experiences was shaped by that. I grew up to listening to James Brown and Be Black and Proud and all of those things of that time period. But at that time in the mid 60s, we were experiencing some of the same things, unfortunately, we're experiencing now. This clear difference between access and opportunities that were playing itself out in terms of poor health outcomes. And what happened then? Jack Geiger said, look, let's create an experiment. And it really was. At the time, the community health center movement was an experiment. But I think the fundamental part of this experiment, which starts to get to the solution, is what they did is they said, you know what? In order to get to true social justice and to get to true change and to create equity, we're going to have to create a different set of rules in terms of how healthcare worked. And I give you just a couple examples. One of those was at a place like the DMIC Center, where we're a federally qualified health center, our scope in terms of our responsibility and duty is to serve the community. That's different from the rest of healthcare. In the rest of healthcare, as a physician, you can decide you're going to see this group of patients, not see that group of patients, going to take this insurance, not that insurance. The fundamental change, that one change, when you think about it, creating that new rule when it came to how we think about the delivery of healthcare, substantially changed the range of opportunities for a whole group of people. There are 30 million people in the United States who are served by this. Now, it took from 1965 to 1975 with then Senator Ted Kennedy to actually put it into law, and then in 2010 becoming part of the Affordable Care Act. But I think it importantly helps us understand that creating solutions here is going to require bold moves and sustained effort over time.
Mm-hmm. Charles, I want to talk a little bit about vaccine hesitance. In many ways, the public health crisis that we've lived in, is problematic on its own. But you have the sort of misinformation and all of the scar tissue that we know exists, particularly within the Black community, but people of color generally, the lack of trust with respect to the government and the healthcare system. These things are almost epidemics of their own. How have you, begun to try to overcome that? Are you pleased with the results you're seeing thus far? Let us into your world in terms of what it's really taken to overcome not just the crisis itself, but all the things that surround it.
Yeah, Greg, it's a challenge. There's no doubt about it. When you have, and the really interesting thing is when the Harvard School of Public Health looked at this, they reached out, big survey, almost 3,000 people. They said, look, let's try to understand what they then called vaccine hesitancy. I like to refer to it as building vaccine confidence. But what they found after they asked a range of questions, and you can imagine they asked questions like, what do you think about your risk of getting the disease? What do you think about your risk of dying from the disease if you get it? And the single most significant variable was an experience of racial discrimination. That was the single most important driver in terms of this hesitancy. And then they dug further and said, well, tell us about those experiences. And you know what? It wasn't all experiences in healthcare. They reported experiences on their job. They reported experiences walking down the street. They reported experiences with policing. These are the things that we're up against. So this is really hard work. What we're doing is we actually are leveraging people who are trusted sources in the community. And that goes back to, quite honestly, some of the fundamentals of what are federally qualified health centers. That is what we're supposed to do. We engage the community, and we've done that with our street team. We are getting in front of people with not only the right message, but the right messenger. And so far, I must say, Greg, we're actually seeing some progress. I started looking primarily within our staff. And our staff, being that we're the largest employer in Roxbury with over 500 employees, our staff represent our community. And I can gladly say that we're actually approaching 70% in terms of vaccination rates with our staff. And that's with these ongoing engagement with people who are trusted sources, delivering a message that's not just about the science, but it's really delivering a message of hope. It's delivering a message of positivity that says, look, we can beat this and we can get back to our normal lives. And they're also talking about how they got through that process. So we're not ignoring the fact that these hesitancy, this lack of trust is real, and in many ways, it's very well warranted.
Yeah, thanks for that. I want to take a step back here. You've been in the role for a little over 2 months now. I know you to be among the most diligent people that I know, so I know how you've prepared for this role. Where do you see biggest opportunities? What are you most excited about in terms of where your leadership can take the Dimick Center?
Yeah, I'll tell you, I've spent time with this organization. It's an amazing, amazing organization. There's so many people who are tuning in now. The real opportunity for us, quite honestly, is I think we have a real opportunity here right now to get even more deeply involved in this community. I think we have the opportunity because we know there's deferred care, there's delayed care. We know that disruptions in care have come from the fact that most of the population in Roxbury, when you think about the median income of $30,000 a year, and you understand that more than 40% of those who lost their jobs during this pandemic were making less than $40,000 a year. We have a real opportunity to be there to help this community repair. It's kind of like the things that you do post-natural disaster. And I think in doing that, people remember when you were there when they needed you most. And I see that as a place that we're going to really double and triple down on.
We have. I'm just going to ask one more question, and then we're going to go to the audience for some Q&A. But one of the things, and I could talk to you all day, Charles, but one of the things you don't escape when you think about healthcare is just the scale of it and how difficult it is. And you can't do that work without philanthropic support. Frame for us, in the clearest terms possible, why Dimick should be someone's top philanthropic priority.
Yeah. Well, I would tell you, one of the things I think is important to communicate, which I did a bit of, but I want to emphasize, we're not just a group of providers providing clinical care in an office. We're in the community, we're engaging. 51% of my health services board are people who receive care in our health center. And they help us understand every day that what we do outside of the walls of those clinics is as critical, if not more critical. So what do I mean by that? We have a scope of care that puts us right at that interface between civil rights and healthcare. Let me go deeper. We will need to continue to support people in food insufficiency, housing insufficiency. We'll have to be involved with things for workforce development. We have a tremendous amount of work to do on top of the delayed and deferred care, which data would suggest that more than 40% of people have delayed or deferred some form of care. So we've got to really get even more engaged. And that is where all the amazing support, and I thank all of our supporters over the years, and I look forward to their continued support. And we know we're going to need even more support there because the obstacles are even higher, the need is even greater. And even if we just say we're going to try to close some of the gaps on this delayed or deferred care, we've got 30 to 40% more care to deliver in a short period of time, which is definitely going to impact our operational budget.
Well, Charles, this, if nothing else, puts on display that you are the right leader for this time. I'm excited to see what DMIC can be under your leadership, and I'm grateful for the opportunity to have shared the stage with you today. I think we're going to go to the audience for some Q&A, and then we'll give way to the rest of the program.
Thank you, Greg.
Well, that's a fantastic conversation, and it's actually really just a starting point. Thank you so much, Dr. Anderson. Thank you, Greg Schell. I have a few questions to kick us off, and then when more come into the Q&A, we'll get there. We have about 10 minutes or so. Greg, if you wouldn't mind, could you talk a little bit more about the new Commonwealth Fund? And really, now it's been in formation for a few months. I think that it's such a critical piece of what we've seen in this Boston landscape around philanthropic support, completely aligning and partnering with healthcare and other organizations. How do you see that role of the fund and its trajectory in the coming months moving forward?
Yeah, thank you for that question. What I would say, a lot of the material that Dr. Anderson talked about is equally true in some other areas, be it education or housing or what have you. There is some covariance between some of the challenges we face in society, and as I mentioned, they're often correlated by race and income. That said, I think one of the things that's also been missing that the new Commonwealth Fund has tried to maybe be an emblem of is people of color coming together to command resources and to give into places where we have particular knowledge and expertise and life's experience. And so this fund has been very broadly supported. Its intent is to be active across the state and to really find organizations and not-for-profits doing the kind of work that needs to be scaled. The data teaches us that in many ways, these organizations in the urban core are often doing incredible work, but for the fact that they have female or people of color as leaders, there is not an opportunity to raise money as efficiently as it would be were it not the case. And so by putting a highlight on those organizations, we stand a chance to accelerate the kinds of solutions we want to see by scaling these not-for-profits. So I hope that the NCF is a pillar institution capable of standing to the sort of enormity of the work that there is to do, but done so based on the cumulative life experience of the 19 founders that came together to kick it off.
That's fantastic. No, thank you for that. I think we've all in the community really been so inspired and grateful to see the launch of the fund and the incredible leadership behind it. Thank you. Just a reminder to all our guests, I'm going to change what I said earlier. Please put questions in the chat instead of the Q&A. We're shifting things a little bit. So we do still have a few more minutes. So if you have a question, just please put it in the chat and we'll be sure to get to it. There is another question, Dr. Anderson. It's, I think, a very practical question, but I know our guests will be interested to hear this. Can you tell us more in a little bit more detail how vaccinations are going at DMIC and what you see it will look like in these coming weeks as things really keep expanding in the Commonwealth?
Sure. Well, with the generous support of our donors and our partners, we've been able to expand our capacity to vaccinate. We've opened a separate space, created a beautiful vaccination clinic on our campus that allows us to get to easily 1,200 vaccines a week and greater. Right now, it really is dependent on supply. We've done some amazing things in terms of volunteer vaccinators and others. So I see over the next coming weeks, especially as we start to open up these other priority groups, that we're going to be able to really be a significant way that people in our community are going to be able to be vaccinated. Although in terms of how it's going, we're already seeing schedules filling up. People actually are very excited about what we're doing and the way we're doing it. And our team is so engaged with how we're delivering that we're really delivering a Class A experience and celebrating what this is. And that's all of us working together to get this pandemic behind us and to emerge from this at around the same time.
Thank you. Here's a question that just came in from our participants. Pandemic has unlocked the potential for telehealth but early reports show that unequal access to telehealth for communities of color. Can you speak to this issue and how DMIC is addressing it?
Yeah, that is a really great question because it also speaks to what is telehealth. Many community health centers, and the DMIC included, have realized very quickly that access to the sort of video conferencing type of telehealth, which is I think what people have in mind, is more challenged in the community that we served because of access issues. What we've done is we actually are delivering a lot of it through audio telehealth. So it's phone calls and that level of engagement. What we're finding is that for certain individuals that we serve, that actually works very well. But in many, you can't substitute for that in-person engagement. Now, with that said, telehealth is here to stay, especially in the world of behavioral health. And I think there are some exciting opportunities to not take this as a hammer looking for a nail, but actually for us to start to define what this tool is in our environment to start to be able to use it more effectively and more efficiently.
Yeah, thank you. Another question that just came in. What messages would you have for promoting equity in healthcare for Australia's Aboriginal and Torres Strait Islanders? That's an interesting question. I think, I have to say, I think we do have someone from Australia with us on the call, which is pretty amazing to think that the DMIC Center has expanded that far.
What section of Roxbury is that?
Well, that's a good question. Do you want to take a stab at addressing that one?
Yeah, I'm not sure I fully understand the question, but I will say this. Again, for every problem we know there's a solution, right? But we also know that we have to engage those who the solution's designed for to make sure that we're not building things that are going to go unused and that are going to end up not delivering the outcomes. So let's start with understanding the outcomes, build it with the individuals in mind that is designed to serve, engage them in that process, and measure the impact and complete that circle so that we're constantly tweaking what we're doing and making it more and more impactful with every turn.
Absolutely, thank you. Question for both of you, Greg and Dr. Anderson, and if you could please just both respond. This is actually a really very important question. I think something that's on a lot of our minds. Realistically, do you see progress on racial and health equity issues in 5 or 10 years? And if so, what does that progress look like?
Charles, you want to go first?
Yeah, I would say this. I am very hopeful. And the reason why I am is that we're having conversations today that are different than what we had 2 years ago. We are open and understanding of the fact that doing things the way we were doing it and expecting different results is just like Einstein said, it's ridiculous. So I'm hopeful that we are going to be able to be clear about the fact that we're going to have to come up with different rules to really, really get to real social justice, and that we're going to be much more comfortable about that, just as we were in the mid-'60s when not only federally qualified health centers emerged, but also early Head Start. That's another great example that reminds us that we can do this. We have the ability, we just need to make sure that we continue to have the will to do the work on an ongoing basis.
Yeah, what I would, the way I see this is that there are two sort of dominant perspectives one can have about the criticality of this topic. On the one hand, you can talk, and they're linked. On the one hand, you can talk about equity and justice, inequality and fairness. On the other hand, and that's being explored more every day, as Charles mentioned. That said, there's another road, and I think it's underexplored, which is how limiting this is for our society. We are less prosperous as a society together for the fact that so many of us live at such a low baseline of the basics around health and housing and educational attainment and so on. And to the extent that human capital is improved and enhanced, healthcare being one of the largest ways that you can do that, we all do benefit. And I think that is something that I've tried to explore economically and in the world of business. And I think it's something that we're only just now getting to explore, frankly. So that link between a more prosperous society and a more just society is not well understood. And I think this period of time helps us see that when so many of our, sort of individuals and families are existing, outside the main, it holds our country back. And we will be, as I mentioned, a more prosperous society, not just a more just one, for our urgent attention to this matter as it extends, beyond, core healthcare. Even things like early childhood education, are things that are deserved of real attention, the sort of returns of which are enormous to society. So I am hopeful for that reason that we are just starting to understand that link. And I think the return on those investments, both people and in time and effort and capital, return you several fold. So I'm excited about that being one of the legacies of what we know has been a tragic period in population health.
Thank you both so much. We'll do one more question before we wrap this amazing part of our agenda up. The question relates to the combined epidemics, the pandemic, the COVID pandemic, and the ongoing opioid epidemic. Dr. Anderson, could you just speak a bit about how you see those aligning, or I guess the perfect storm of them, and more, what is really DMIC's role in addressing both at this time?
Yes, well, at the DMIC Center, we are actually seeing that. We are one of the few places in the state where on one campus, you have this full continuum to take someone from detox, even if they're COVID positive, taking them from detox all the way through to a sober home and then integrating them back into their community. So we have the ability, and we're seeing all aspects of that, and we're seeing increased demand for those services. Where is it coming from? People have lost their jobs. They've lost loved ones. There's been incredible disruption. And anytime you have that, it leaves someone that much more vulnerable. So I'm very concerned that we're only seeing the tip of the iceberg. And as I often say, it's what's beneath the water that sunk the Titanic. We're going to have to really increase our capacity to meet those needs. And we're already working on that on our campus through the wonderful support that we receive. And quite honestly, through all the amazing things that prior individuals who've sat in this very seat have done to prepare us for just a time as this.
Thank you. Thank you for that. Thank you so much, both Dr. Anderson and Greg Schell. That was a fantastic conversation. It is really just the beginning of an important conversation that we all look forward to continuing. Now we're honored that a few of our Commonwealth's legislative leaders are here with us today. It's a pleasure to first introduce Attorney General Maura Healey, who every day fights for equity and justice for DMIC community members and all residents of the Commonwealth.
Well, hey, thank you so much. It's really great to be with you. I've been a fan of DMIC for so long. Have enjoyed getting out there in the past, and I want to thank Raquel, and I want to thank everybody at DMIC for inviting me to be here today. Congratulations to Dr. Anderson. We spoke a little while ago, and so excited about your new role and what you're going to do. And I just want to thank everybody at DMIC, those who support, those who work there. Many of you have been on the front lines providing care to your communities throughout this pandemic, and your mission to provide equitable access to comprehensive health and to healthcare education, is critical. And of course, you all knew about disparities in healthcare long before the rest of the nation started waking up to it, as we watched our Black and brown brothers and sisters die and get infected and diseased in totally disproportionate numbers. Not surprising to you, of course, in the field. And I think that if anything, this moment that we've been living in, a year just about of COVID coming here, and this pandemic, which has exposed and exacerbated racial and ethnic disparities. I think that, alongside what happened in the aftermath of George Floyd's murder, and I say that word intentionally, though he was not technically, that has not yet been determined. But I would say that this moment, provides us an opportunity to really reassess and to build anew in different ways that will hopefully rid us of some of the systemic disparities that have persisted for far too long. We know today as we sit here that the health risks, the financial risks, the toll of COVID-19 has not been evenly distributed. Over the last year, our Black and Brown residents have been more likely to be infected and hospitalized than white residents. We know about the disproportionate death rates. In addition, all that's meant in terms of what's happened to people's livelihoods and, the economic consequences of this, the consequences of, single parents, both having to work essential jobs and also make sure their kids are able to access some form of online school. We think about the mental health needs and the behavioral health needs and how profound they will be coming out of this crisis when so many already traumatized have been further traumatized. And, I just want to commend Demick for everything that you stand for and everything that you do, and know that you have a partner in me in my office. These disparities, I've talked a lot the last few weeks about my concerns about vaccination rollouts and the need to make sure we have a community-centered, a trauma-centered, a victim-centered approach to vaccination. Those closest to the pain, as my friend Ayanna Pressley would say, should be closest to the solution. And not only are communities of color more likely to have been harmed through COVID-19, they remain disproportionately at risk. I can't tell you how many stories I continue to hear from people who've lost their mother, their father, their sister, their brother, their grandmother, their cousin, all within one family, right? And I only hear that from Black and Brown residents that I speak with. And that's not to say that hurt hasn't been visited upon all communities and all families, irrespective of race. But and I know who's borne the real burden here. And so thank you. As we move towards a new federal administration, that believes in things like science and data, thank goodness, that stands for equity and equality, that understands the need to see life through the experiences of another, I think we'll have good partners on the federal level. And I want you to know that, we've made healthcare equity the focus, the center of the work out of my healthcare division in the office. And we've made equity the focus of the entire office. There is an equity lens that I've asked every single member of our 600-person team to apply to the work that they do. When it came to healthcare, we, of course, put out a report earlier this year, this past fall, with actual recommendations on how we can translate our shared commitment to health equity in action. I highlighted, I didn't actually, big thanks to Sandy Walensky and Noam Yosefi for their work on this. I commend it to you if you haven't seen it, but things like robust data and reporting, helping us to identify disparities and to more equitably distribute healthcare resources and to track our progress towards health equity. Community health centers who have unmatched expertise in collecting patient data on race, ethnicity, and other social determinants of health. I am asking you to share that expertise across our healthcare system so that Massachusetts can be the national leader in healthcare data collection that it should be. Second, let's be real honest about acknowledging healthcare affordability as an equity priority and consider new ways to ensure that cost doesn't prevent people from seeking care or filling needed prescriptions. Third, let's make sure that clinical healthcare tools work to promote health equity, starting with telehealth. We've seen through this pandemic, people benefit from the ability to have telehealth visits. With the new state telehealth law, virtual visits are here to stay. But We know that telehealth may perpetuate or worsen the disparities in healthcare unless we address things like the digital divide and ensure that people truly have access. Fourth, we need a diverse workforce, right? We need a diverse workforce, and that is absolutely imperative. And right now, our communities of color are underrepresented. We've got to expand affordable and inclusive educational opportunities. We've got to implement anti-racist and cultural humility, cultural competency trainings in medical education and licensure and certification. And finally, we know that clinical care only accounts for a piece of health outcomes. And that's why my office is focused on the whole spectrum. Healthcare doesn't start with a trip to the community health center or the hospital, even worse. The social, economic, environmental conditions play such a large role in determining health outcomes. That's what I want to take on together as a state. Let's target funding towards upstream social services that address the root causes of health inequity. Let's, support our health care institutions that play an anchor role in their communities, right? To leverage their economic power and human and intellectual resources to support a health equity mission. And I know no one understands that better than DMIC. You've always had the community at the center of what you do. And there's a lot you can teach our larger healthcare systems about making a difference across a broad spectrum of issues. So as I say, the inequities, disparities, always present, revealed to some for the first time in new and different ways, certainly exacerbated, have given us an opportunity. And I am confident that here in Massachusetts, this state of all states, right, we have the resources, the talent, the will, the vision to emerge so much stronger, not only as a leader in healthcare, but as a leader in health equity. So thank you for everything that you do. We appreciate it. Our teams will keep talking to you. And I invite you, as always, to share your thoughts and ideas with me and our team to make us better as we move forward in a shared mission of a more equitable healthcare system and better health outcomes for all in our state. Thanks.
Thank you so much. Thank you so much, Attorney General Healy. You really are a fantastic advocate, champion, and your passion is contagious, and we absolutely will be right there with you, partnering as we move forward. I'd love to now introduce City of Boston's Chief of Health and Human Services, Marty Martinez. Chief Martinez, Mayor Walsh, and now Mayor Janey have been tireless supporters of DMIC, and we are deeply grateful for the city's incredible support for our pandemic response in particular through the Boston Resiliency Fund.
Well, thank you so much for having me here, and appreciate being able to join you all. This is, I think, the second annual meeting that I've been able to come to, the first virtual, but I hope and look forward to being with folks again in person. And I just want to add to the chorus of thank yous to DMIC and the words from the Attorney General. That the work that you all do to center equity in the community, to center your response, and to ensure that access exists for our community is so incredibly important. As we think about where we're at today, obviously coming to you from the city's Health and Human Services Department, coming to you prior from the Walsh administration and now the Janey administration, I am eager to be here with you in the scope of your racial and health equity frame that you have for this annual meeting. And it's so important, right? I mean, we've been through one of the most challenging times as Bostonians. We've been through a very difficult year, a year where we have seen the inequities that we all knew existed, but saw a light shine upon those inequities in a way that put people at greater risk, not just from the physical impact of COVID, but all the mitigating things we had to do and the economic impact it had on people's lives, people's ability to put food on the table, keep a roof over the head of their families, and take care of themselves and everyone they care about. And so those inequities have been striking. And there's no other way to think about this year than to think about it from a racial and health equity lens. But one of the things that I think I'm struck by, and DMIC has played a role in that, no question, is how we've come together as a city, how we've come together to respond. Whether it's the work we've seen around feeding our families and food distribution, whether it's the work that DMIC has done related to testing and contact tracing, and whether the work we're doing now and that DMIC's playing around creating access to the vaccine and building support and confidence in that vaccine. It's all part of the work that we've done as Bostonians, and the work that we continue to do together. I think every day about all the challenges we've experienced and all the tough moments that have been a part of this year. As the Chief of Health and Human Services in the city, we have looked at some difficult decisions we've had to make, some difficult times that we've had to endure. But I think at the end, as we think so much about the light at the end of the tunnel, as we think about recovering out of COVID, we really think a lot about what does it take to do that. How do we recover in a way that's more equitable than the way we entered into COVID? We have to think about that. We have to work through it. And we really have to make sure that those inequities that have been in front of us, those inequities that we've seen day to day play out in the data, the inequities we've seen play out in who's had access to resources and services to help their families, they're real. Every single week, we have a health inequities task force that Mayor Walsh put together. And that task force looks at data. It looks at the disparities that exist. It looks at the strategies that we're using to counter some of these inequities that exist. And it's doing something that I will argue my building, City Hall, isn't always great at. It's been nimble. We've been able and had to be nimble to respond to these challenges. And so we're proud to have partnered with DMIC through the Resiliency Fund to support important efforts that you all have put in place, not only to deal with COVID, but to address the opioid epidemic and the substance use disorder epidemic that people experience, but to create real access for folks in our communities. And so to me, it's that pride, it's that support, it's the strength that Bostonians have shown that DMIC has played a key role in and has been a huge part of it. But we have a lot more work to do. I know no one watching this meeting and no one at DMIC thinks that we don't have a lot of work to do. Dr. Anderson, Bob Rivers, the leadership at DMIC, I know you all know that we have to continue to keep our sleeves rolled up. We have to continue to create access where we need it. And we have to continue to make sure that all the work that has to happen is truly going to turn into looking at solutions that are different than what we've had before. We cannot continue the same route and want to get somewhere different and want to change some of the outcomes that are there. And I know you all are ready to do that, and the city's proud to do it with you. I'll leave you with one last note. I've been volunteering and working and supporting vaccine sites across the city so we can create access. And I have to say, working at Reggie Lewis Center a couple different times and creating access to the vaccine there, I've been struck at the hope, especially some of our older Bostonians have had, coming in to get vaccinated, coming in knowing that we could get to a better place, and coming in knowing that that shot in the arm is a start, and there's so much more to come from that we have to all work on together. I've been struck by that personally. I've been struck by that and the impact that we have had in our Black and Brown communities in the city. But I remain committed, along with DMIC as a partner, that the better days are ahead, and we will continue to do the work necessary to make sure that we recover in a more equitable way, and that we build back up, because that's what we do as Bostonians, and I know DMIC will be right there to do that with all of us. So thank you so much for having me, and I'm glad I could be here with you. Thank you.
Thank you so much, Chief Martinez. That's a wonderful reminder that we all need to have hope together, and we as Bostonians, we are strong, we are resilient, and we know what we need to do, and we will do this together. So thank you for that. It's a pleasure to introduce Massachusetts State Representative John Santiago. He's also a physician at our partner, Boston Medical Center, and sees firsthand the challenges faced by our community. We're so glad you're with us today. Thank you for joining us.
Great. Well, thank you, Raquel, for the kind introduction, and to the Dimmick Community Health Center for all the work you do each and every day. I'm very much honored to participate in this annual meeting and to really be a partner with you on the front lines. You know, as Raquel mentioned, I work as an emergency room doctor at Boston Medical Center, and it's been a very difficult year for a lot of us in a whole host of different ways. And so I'm incredibly grateful for your partnership and for that of Attorney General Healy and Chief Martinez, who I consider public servants with me in the fight against COVID and health inequity, and to Dr. Anderson as well, who I've had the opportunity to meet on a variety of different occasions, and we always have an interesting talk about health equity and a whole host of different issues. But to me, this conversation about health equity, it strikes me as an important one, obviously, not just in the work we do, but also our personal stories. I would imagine there are people on this phone call who got into health, medicine, public health as a result of their background, right? So if there's any silver lining in this year of madness and this year of COVID-19, my hope is that the next generation of public health leaders, of physicians, scientists, will enter this new era. And I think about my own background. You know, I grew up in Boston for a number of years in Roxbury, and if it wasn't for an HIV infection my uncle had, who ultimately passed away from AIDS, his only crime being that he was a poor Latino man who couldn't access healthcare, that resulted in me getting involved and engaged with health equity issues at a very young age. It struck me as unjust. It brought on this curiosity that would lead me to really travel the world, get involved with healthcare, and to come back to Boston and get involved at the medical level. And for the past 6 years, I've worked at Boston Medical Center as an ER doctor. And what you come to learn working on the front lines at a place like BMC is that whether it's a stroke, heart attack, gunshot wound, what have you, that those issues are directly related to what's going on in the community. And in my case, the communities of Roxbury, Dorchester, Mattapan, and the South End. And what you come to understand is that the patterns that you see in the emergency department are a result of the social determinants of health, right? And so when I ran for the first time in public office, my goal was really to take the stories of my patients with me to Beacon Hill, to fight for them and advocate for them, right? And for the past couple of years, we've been very fortunate to use their stories and their experiences to pass important legislation. Things like banning flavored e-cigarettes, the distracted driving bill, and a number of policies that continue to fight for health equity. But over this past year, COVID came and our lives turned upside down, including my own. In fact, I doubled my hours in the emergency room. I went from working 3 days every other week to 3 days every week, in addition to my healthcare, my responsibilities on the Hill. And I saw firsthand the disparities that I knew from my own personal story and as a professional physician working on the front lines. These patterns of seeing the poor essential worker from East Boston get care, or the African-American woman from Mattapan come to my emergency room, sick, perhaps requiring intubation, hospitalization. I mean, these stared me right in the eye, and we got active on this on Beacon Hill to really address this stuff with my colleagues of color on the Hill. And over the course of this past year, I'm happy to say, I think at least I'm seeing some light at the end of the tunnel. Here we are vaccinating folks. You know, obviously things got off to a bumpy start. You know, still today, we're fighting for better vaccine equity at the top level. We've been able to expand and increase our numbers vaccinated, doses administered per capita, but we still have a tremendous amount of work to do when it comes to vaccine equity. And that's where the role of community centers like yours and BMC and community centers across Boston played an instrumental role in doing. So I want to talk to you about one initiative that we've started, hopefully able to partner with places like Dimmick in the future. It's called GOT Vax. It's a name that comes from GOTV, which is Get Out the Vote. And the idea is that I grew frustrated with the lack of vaccine equity across communities of color. You know, we've been fighting for this on Beacon Hill, you know, pushing the governor to move in a direction that was more equitable. But in my local community, in my neighbors, literally across the street, you know, people didn't have access to the vaccine. And so working with a lot of Black and brown physicians in a local community health center, in a logistics company, we were able to bring vaccines to the most difficult patients, the most vulnerable patients who otherwise would not get vaccinated. So for the past 2 weeks, we've used community organizing techniques, really get out the vote techniques, whether that's a text, phone call, door knocking, to vaccinate 300 of the most vulnerable people in my community. Now, these efforts are going to have to be replicated all across the city, all across the state in order to achieve that equity. But to me, it gives hope that if you partner with your local organizations, if you come up with a plan, if you frame that in terms of equity, that you can get things done. So we vaccinated 300 people, and I'm hoping over the course of the coming weeks, months, that as the eligibility increases, that we do more and more, particularly focused on those patients who are least likely to get the vaccination, which are the same patients, in my experience, are the most likely to get infected and pass away. Patients that I see on the front lines who otherwise would not have access to a vaccination. And I know DMIC cares very much about those same issues and those same patients, and they're a partner in the fight. And so as we move forward in this vaccination rollout, I'm fortunate to call you as a partner, to work with you, and to advocate for you on Beacon Hill, to fund our community health centers, to fund the important work you're doing, to fund the projects that you have going on that are really focused on taking care of our most vulnerable patients. So it's really an honor to be here with you on this important your annual meeting, and I look forward to working with you in the near future.
Thank you so much, Representative Santiago. That's really inspiring, and it's a great reminder. We all know that working together and sometimes just that really personal one-on-one touch makes a huge impact and a lasting impact. Thank you. Before we conclude, let's watch one more video of a DMIC Vaccine Street team member. This one features Annie Russell, a longtime Roxbury resident, DMIC patient, and a member of our DMIC Health Services Board.
There's pros and cons on both sides. I had to weigh them in regards to my own health, my age, and the fact that this is supposed to be a lifesaver for us in the United States. I realized that taking this vaccine was going to help save my life and my family life, my immediate family's life, and others around me, and that really made me decide to take the vaccine. What I really want is to be able to have a full life at my age with my husband and my children, go out to dinner, visit, my children at their homes. And I try to make people of color understand that we're not the only one getting the vaccine. That's the most important thing. The whole world, no matter what color you are getting that vaccine. So we need to live in the right now and not look back at history on what things have been done to us as people of color. I praise the Lord that we have a DMIC Community Health Center. Their mission statement is exactly what they are. They're all about caring for the residents in the neighborhood and in the community.
Thank you so much, Annie, for your beautiful message and for all you do for DMIC. And thank you again to all our speakers for your inspiring remarks, tremendous support, and leadership. And thank you, everyone, DMIC family, for being with us today. It was great to be together. And as I hope you'll stay connected with us. Pretty soon, we'll be back in person. We're confident of that. And we want to stay connected with you as we move forward in these coming months. Sign up for our email newsletter on our website, dmic.org. Follow us on social media. Be sure to save the dates for our Road to Wellness 5K walk run in September, Steppin' Out in October, and all of our other wonderful activities. In a moment, we'll show you a slide with that information on it so you can save the date. And last, please reach out to me. I'd love to connect if you have another idea or a desire to get more engaged here with DMIC. My contact information is also on the slide coming up. Thank you all again. Stay safe, be well, and see you soon. Have a great afternoon.